work with. So it was quite difficult coming in without any idea of what was going to be, what was going to be involved with this project. But Judi has an amazing knack of drawing all these things together and making sense of them. So you'll hear that as Judi speaks, I suppose, and we'll acknowledge her and the rest of the team later. But it's just important, I think, now for me to just acknowledge Judi, how fabulous it's been working with you. So let's hear from Judi, and don't forget, if you'd like to jot down any questions, please do so as Judi talks, and there should be time at the end to ask Judi questions.
Very much, Judi. Wow, it's just so lovely to look around and see everybody. You know, I always have a little bit of a fear at the beginning of these functions that nobody's going to turn up. So, you know, my fears have been allayed. Thank you very much for being here. I haven't sort of prepared a formal thing, but I just wanted to step you through what we've been doing over the last 18 months. Let me give you a little bit of a... It started off as a 3-phase project, and then it grew to a 4-phase project, and we're now actually in the 5th phase, even though the project funding has actually finished, but I'll explain that as we go through. So, as you've probably got the message that people have been talking, it was a bit difficult to begin with to really fathom out what it was we were going to do, because this is an action research initiative, and that's what Susan's going to talk about afterwards, so I won't steal your thunder, Susan, on that. But it's grown, it's developed, but we were not quite sure what it was we were doing. We knew that this was around primary care, but we weren't quite sure how it was going to emerge. But the first thing that happened was we had to change the name, because every time you mentioned the 2 words anticipatory care, you got these incredibly blank looks. Apart from those of us who might have worked with the National Health Service in the UK, who have perhaps a bit more of an idea. So I'm just trying to remember when it was. It was at the practice, wasn't it, Emil? It was one of our steering committee meetings. We had a very small little steering committee, which was really about the governance side of things, which Emil chaired, and the other practice principals, and Dr. Lizzie Shires, who's also director of the Royal Clinical School in this region. And yes, and we debated a name, what name should we be? And it was John, I think, came up with Connecting Care, and it just took off from there, and it just seemed to say everything about connecting care. So we became Connecting Care. So the first couple of phases was really about working out what it was we were going to do, because we knew that this needed to be based on evidence. We knew it needed to be community driven. And I suppose the key thing was, how do we work with community leaders to actually come up with ideas as to what was going to unfold in this project. And a number of you in this room were here in this room. It was actually April the 1st last year, which I don't know whether that was significant or not. But we sat down with help from Susan and Flora and other colleagues, and really tried to nut out what have we found out so far, and community surveys, really looking at the demographics, the epidemiology of our local area, and we actually came up with some ideas, and we had a fantastic community reference group, not big, but very feisty, who didn't just sit there and nod, but were really, really engaged in what we were doing. And they took away, the learnings from that workshop and came up with 3 things that we felt were concerns in the community about how on earth do we utilise what we have around us, what we have in the community, to sort of make those links and those connections with not just health but social care, community services. And so these were the 3 concerns that came out of the workshop. This is what the community reference group actually came up with, and this has formed the basis for all we've done since then. So we turned these into, to use project terminology, target outcomes, and we designed things to reach those target outcomes. So the 3 concerns was some really quite interesting beliefs and attitudes in our community about our health and about particularly the healthcare system. Remember, this is pre-COVID stuff as well, but you know, some fairly traditional views, some quite concerning attitudes that, you know, somebody else is responsible for my health and well-being. People not really taking ownership of their health. So that was a bit of a concern. The second thing was, how do you find out about what's going on, both within the health system but locally, all the stuff that's going on, which could be of great importance to helping us as a community improve our health and well-being. There's tons of information around, but it's so bitty, and a lot of it is out of date, and so you don't know what's reliable and what's not reliable. So that was a concern. And how do you actually navigate all these systems? We needed some help here. And then the third thing was, I've never been in a community where there's so much going on. But what was a bit of a surprise was that we realised that we weren't very good at talking to each other. A lot of community groups, a lot of service organisations, tons of stuff happening, but people weren't communicating, weren't really collaborating as effectively as we could do. So that was the third concern. So that really formed the basis of everything we've been doing. Now, the community reference group was adamant that we were not going to do lots of little piffling things for 6 months and then the end of the project and the money finishes and everybody says goodbye and there's nothing left. So we said, right, we're going to do proof of concept activities. We're going to try some things out. We're going to dip our toes in the water and just see if this has got any traction and get feedback on stuff as well. So we looked at the idea of, you know, how we're going to get this accessible information and what's this information going to look like. So we decided that we'd try out some information hubs. We looked at it from different perspectives, virtual type hubs, physical type hubs. So we worked, and this is the start of a beautiful relationship with Alderson Secondary College, which blossomed into a very strong working relationship with Collective Ed. But I don't know, does everybody know that Alderson Secondary College has got a really nice shop front up by the clock? So, you know, we thought, let's try out having a bit of a hub there. We did, you know, some other things as well. We worked with Salvation Army, the Bridge Programme, because that was a really great way, while something was going on, to actually be able to tap into that and have, if you like, a pop-up type hub at the Bridge Programme. And Festival in the Park, we had a pop-up hub there as well. But you have to have the information, so we started to, you know, try out different ways and means of putting information together. And that was the genesis of the Connecting Care portal, which we will talk about a bit later on. We also were concerned, as you would have seen before, about how do we navigate our way, how do we work with people so that we can make some sort of sense about what's available. So we started looking at different health literacy initiatives, and we thought we'd try out something a bit different. What we wanted to do was to work with frontline people in local businesses, in shops, the banks, well, if there are any left, the hairdressers, the newsagents, and train frontline staff, and thanks to Michelle Towell, who was so great at putting all of this together, so that they could become connectors and use the resources that we were developing, such as the Connecting Care portal, to be able to work with people who they come across every day, whether you're a receptionist at the Central Coast Council, wherever you happen to be. So we tried these things out. And at the same time we were working within Patrick Street and Victoria Street clinics, working with the GPs and the practice staff. We actually did a very extensive audit of all their records. This was all obviously done confidentially and de-identified, to see how well they were actually managing people who have chronic health conditions within the practice. And I must admit, both practices scrubbed up really, really well. We should be extremely proud of the way our GP practices in Alveston do this. At the same time, we were thinking, now, how on earth are we going to make this last? We need some sort of community governance framework, community-driven governance framework. So each of these little proof of concept activities had a working group, and I see people around at the moment who are on those working groups, and I really need to thank you for all your input. So we started to look and research different sort of community governance frameworks, and I'll show you what we came up with. Now, this is the genesis of where we're going with our partners, Collective Ed, into the future. But this is what we put together, and we tried it out. Our community reference group morphed miraculously into a leadership roundtable. And the idea was that, if you can get community leaders around the table, and then they will be able to bring their ideas from their constituents, so that we can actually start doing the doing. Set up some action groups, maybe one on health literacy, taking up some of the things we were doing there, maybe one round about the information hubs. So do you get the idea of what we were trying to do? So it was terrific, and I need to say a big thank you. I'm just looking around for Holly Stubbs, but I don't think she's here. Because Holly was our first project support officer, who was very instrumental in keeping these things moving, and particularly getting the local resource directory, which you will be introduced to in a minute, which is really the jewel in the crown of the Connecting Care portal. I'd like to thank Tom. Tom joined us when Holly left Patrick Street Clinic, and Tom just happened to be around at the time, which was fantastic, and stepped into the breach as project support officer. Tom, what was one significant thing that you gained from this project, your involvement in the project?
Through the project, because I've lived in Alveston my entire life, up until recently, but I kind of finally saw Alveston for what it was. Like, even though I've spent my entire life there, I never really knew that there was this kind of network of community leaders who are very, very passionate about the community and who have these wonderful ideas and this drive. And it was just amazing kind of seeing that community through my work. And I gained so much out of it. It was really good. Thanks, Judi.
Thanks. And we gain from having you here. So Tom's a medical student, so I'm hoping that you learned as much about public health as we learned from you. So that was all good. Then we got to the end of the proof of concept project, and that was when the project was supposed to finish, and we weren't ready for it to finish. And thankfully, Flora and her group managed to wave the magic wand and produce a bit more money and more time, 6 months, to do what we called phase 4. Now this was really about making sure that we had things that would have a future, using all our learnings from those proof of concept activities. And you'll see that theme is still there coming through. So what did we do? We built the Connecting Care portal, making sure that it was being built in such a way that it wasn't going to fall over, that it wasn't going to get out of date, and finding a home for it for the future. And I have to thank Gary Walker, no relation, no nepotism here, and Hayley, who have been instrumental in phase 4, and they're going to talk to you in a minute. But Gary, did you want to think of anything which you take away from your involvement in this project? And Gary's been in on it right from the very beginning.
Well, I guess for me, living in Ulverston all my life, I was actually quite surprised at the number of different community services that are available around the town in the Central Coast, and it's there are so many. There's so many different broad areas that there's something for everyone, and I think the community as a whole probably isn't aware of that and doesn't realise it. So hopefully through this project and the activities that we've done and the legacy that we'll leave from it, there will be a place where people can find out what's going on in the community, what is relevant to them.
Thank you, Gary. And Hayley, did you want to say anything?
No.
I haven't lived in Ulverston all my life. I've travelled around a lot, and but I mirror what Gary said. Is I moved here from Cairns, from the hot to the cold, and I didn't know anything that was happening in the local community. I didn't know what I could get involved in, how I could make friends, and so for me it will be the directory, the portal, so the community can find out what's going on and what's happening. So that.
Thank you. So we were gradually starting to expand the thinking, the concept, much more towards a community well-being perspective, not only a narrower health perspective, and looking at the ingredients of community well-being, which of course include a very, very important ingredients, and that's education and training. And that's where the partnership with Collective Ed, initially through the Doors to Mentors programme, started to evolve. So that second dot point, it was about how do we set up this governance framework. We'd, done a bit of work, we'd come up with something, it wasn't perfect, but we needed now to work with our Collective Ed colleagues and see if we could come up with something which was going to last into the future. And you've got some A3 copies of it on your table, and the big posters here, but we'll come back to that a bit later on. We worked with Michelle Towell to really try to advance that idea of community health literacy, and we were still working with the practices, and particularly with 4th and 5th year medical students from the Royal Clinical School. We've done some super projects. And when the final report is published on our portal, you'll be able to read all about those. I won't go into them now, but there's been some terrific stuff. But of course, guess what happened? We got caught up in COVID-19, and you know, half of the people or the businesses or the service organisations we were working with were either just absolutely, you know, full of everything and just had no space and no time, or unfortunately they disappeared, closed their doors. So it actually made it quite difficult doing all this stuff. We Zoomed all over the place, we did the health literacy training by Zoom, but it was a little bit awkward. Hayley was tearing out her hair, and I must acknowledge Vanessa Morley, who's not here, who was also working with the team, because trying to make contact with organisations that had closed their doors for a while was a tad difficult. But anyhow, we managed, and we built on all the things from the proof of concept stuff, the good stuff. A lot of it we didn't progress because people had said, don't waste your time on it. And we have come out with some tangible outcomes. I'm actually going to leave that here because it will come back when we introduce you to the portal and also to the community wellbeing governance structure. So I hope this has made sense. It's been an interesting journey. I must acknowledge Marie Gleeson, because Marie did the local evaluation for us, and we learned so much from Marie's evaluation, and that's what evaluations are all about. It's all about learning and taking it forward. Marie, did you want to say anything about, you know, what you took away from your involvement in this project?
I really can't say no, can I? Look, I think having been involved in health and community work for many years, what I realised is that communities just have some amazing people in them that we've already heard about, and they're right at our fingertips, and that resourcing really comes from people working together, not the money. There's a lot of resources and money that comes to organisations, to communities, but if you don't have the people there to mobilise that, then it just doesn't happen. You know, for the good of the outcomes of their people. But one of the things that came out of the evaluation that I guess everybody would have been aware of and which we've talked about is you have to actually have a really good lead person. But to support that person, you have to have other really good professional people who can move things along. And things get moved along because things have happened before. And I think that's one thing that we don't realise is that every bit of work that we all do actually becomes part of the bigger jigsaw puzzle to make communities work and to make our health outcomes better. And I think that that's where we are absolutely on that trajectory now. And that was very clear in the evaluation, is that everyone who was either surveyed or interviewed said how they loved contributing to the bigger picture and moving this forward. So I'm really looking forward to all sharing with everybody else what's going to happen next, because that will be the answer to our community, and that we'll have a really good group of people who will keep forwarding our health outcomes and making sure that education and health are linked instead of being separate. That's it.
Thank you. Keep doing that, don't I? So we're going to come back to the legacies of the Central Coast, but what we really want to do now is find out all the action research outcomes, and I'm really, really interested in hearing what Susan's got to say, because all of this was going on at the same time. Sometimes we got a bit confused, didn't we, because we weren't quite sure who was doing what. Was it the university or was it us? But that was all part of the learning as well. And it's been great working with you, Susan, and your colleagues, and Robin Crabbe is here as well. Where's Robin? There you are. Who has worked closely with Susan. So I'd like to say a big thank you to you, and look forward to what you're going to say.